think that growing body of research is really helpful. So that's on the journalism front. But then we also brought up the overrepresentation of mass shootings. I just want to circle back to that.
Yeah, please.
It really had a lot to do with who the victim was. Some veteran researchers who have been in the field for decades have telling me there was an approach to let them die, essentially, let the worst of the worst kill each other off.
Welcome to The Incredible Messenger, a blend of real-world stories, expert insights, and proven strategies that keep our families, communities, and cities safe and healthy. Moving beyond rhetoric and politics to practical solutions and community safety, here's your host, Jonathan McMillan.
What's up, y'all? What's up, y'all? This is Jonathan McMillan, and we are back with another episode of The Incredible Messenger. I am excited, as always, about the next guest that we have on the show because the publication that she works for is very unique within the world of gun violence prevention, the Trace. It is the only national publication that is dedicated to conversations and news stories about gun violence prevention. And it's not just covering events, it's also covering the legislative side of it, the environmental side of it. And our guest today, Fairriona Magee, the public health aspects to gun violence. This just feels like this is going to be a really exciting conversation as two of my loves, journalism, public health, well, I guess three of them, gun violence prevention, all come together. So with no further ado, Fairriona Magee, welcome to The Incredible Messenger.
Thank you so much for having me. I really do appreciate that. And thanks for that. Awesome introduction. That kind of covered him nicely. But yeah, I'm Fairriona Magee. I am the public health reporter at The Trace, the nonprofit independent newsroom that covers gun violence throughout the country. And we are the only people who exclusively cover that. And yeah, I'm the public health reporter. Public health is the science of population health, essentially, compared to individualized health, which we commonly refer to as healthcare. Oftentimes, when I tell people I'm a public health reporter that covers gun violence, they're like, what? So there's essentially a four-step approach to addressing any health issue as a public health issue. The first is surveillance. So it's defining the problem. Okay, like what's going on, assessing it. The next is identifying risk factors, protective factors, and what works well. So essentially, like what causes gun violence and what solves it. So that's a huge research aspect. The next is really about designing strategies that could work to see what works well to address it, to see what we can do to solve the problem. And then the last, implementation. So it's like taking all of that research, taking all of that data and applying it. So that's what I do basically from a gun violence perspective as a gun violence reporter.
So I'm glad you broke down that public health framework. And look, people get tired of me always talking about, okay, here are the four elements of a public health framework. I'm glad you did it for me on this episode. It wasn't just me, y'all. See, so let's talk about what drove you to be a journalist, specifically taking a public health approach to gun violence prevention.
I always like talking about this because I feel like every time I talk about it, I discover something new in my response. I was always a curious kid, always asked a lot of questions, always read a lot. And I think too, especially like growing up as a young Black girl, you're very curious to why things are the way they are and you're searching for answers. So like from a adolescent perspective, that's who I always was. I attended North Carolina A&T State University for undergrad and I majored in journalism. And from there, that my interest in science and health really fostered itself, essentially being in that type of space and specializing in what did I want to cover. I wanted to cover a topic. I wanted to talk to people. I wanted to learn about it. And I really wanted to assess what that meant. And I went to the Missouri School of Journalism for grad school. And this is when my interest in public health really grew and really from a community angle. I did a lot of work when I was at Mizzou, really centered around science and health. And the way that Mizzou is structured, they have a publication called the Missourian, and their public safety and health beat are combined. And I was assigned as a public safety and health reporter. This is during the time of the pandemic, so there's a lot going on with just me personally, right? Like trying to navigate that space, but also to gun violence. And my first day as a public safety and health reporter, I attended a shooting, essentially. It's the aftermath of it, right? So there's police everywhere, there's family crying, and I'm trying to assess the situation. And from being in that space, I'm studying about health, I'm writing about health, but I'm also able to write about public safety, talk to people on the ground. I was really able to understand that this is the space that I wanted to be in. And even outside of that, I did a lot of work too when I was there around analyzing why public health reporting is structured the way it is. I did a textual analysis at the time comparing crack cocaine to news coverage. And I wanted to see the differences and the parallels. I'm like, why is this topic addressed as a public health topic and why is this one not? The more you do stuff like that, the more you read, the more you understand is that I wanted to be in a space to where I could really cover a topic in the same way. And then too, being a young Black girl growing up, you see people get shot, people who have been shot, you're always around it. So it was just like a natural progression to me going to this space and something that I really have thoroughly enjoyed. Even though it's a difficult topic to cover, it's just something that's really important.
You mentioned the difference between how the opioid crisis was treated by the general public versus how the crack crisis was covered by national media, by people in general. There was clear difference. One of my previous guests, Dr. Shawnee Buggs, she and I had a conversation on the show about how when the mass shooting happened at the Aurora Theater here in Colorado, how that was covered versus how community shootings happen in Baltimore. The response to Baltimore is that we need more law enforcement, more suppression tactics, et cetera, versus a mass shooting happening in Aurora. It was like, oh, we need to have more legislation and whatever the response was. This is my question for you. When the conversation about gun violence prevention happens, it's usually bifurcated between gun control and gun rights. And oftentimes, those who are the loudest in the room, the ones who get the most media coverage, are people who are most concerned about preventing mass shootings, school shootings. And there's very little conversation to be had about shootings in Black and brown communities, what we would call community violence or interpersonal violence. There's very little conversation about domestic and intimate partner violence. And there's almost a taboo reluctance to talk about firearm related suicides. Can you talk about what the role is for the media in general in responsibly talking about those other ones that don't get the lion's share of coverage? And what is you and the Trace's approach to covering those other topics?
Really, really important question. I'm so happy that you asked that. And it's something I probably talk about all day as a gun reporter. I hope I don't veer too far off. So if I go too far off in answering this,
We just talk
in the right direction. So when we look at the history of gun violence as a public health issue, we see nearly 4 decades ago, researchers are beginning to sound the alarm, right? Specifically at universities like Johns Hopkins, we look at people like Aaron Wintemute. There's people in the gun violence space who are looking at the data and saying that this is an issue. In the way that they were just sidelined, they blatantly said this is not a public health issue. There's not enough information. There's this, that, and the third. It had a lot to do with who was being shot and who was dying, blatantly from what I hear from researchers. We saw during this time period that Black people were being overrepresented in these shootings. There was a complete disregard. And the media played a role in our understanding of that. So the framing, the language, and things of that nature, right? And then we see with the 1996 Dickey Amendment that literally gun violence research to a large degree. So from this period of people sounding alarm, trying to speak about it, trying to bring attention to it, and to be completely disregarded because who the victims are, it becomes a really difficult uphill battle. And it is not really until years later that we really see through the rise of mass shootings that the language around gun violence as a public health issue begins to emerge, right? People begin to have a lot of concern. And I think it's important to say that the media plays a role in whose story is important, right? So we look at the history of if it bleeds, it leads. A lot of that damaging reporting that took place in the late 80s, 90s, early 2000s that really fueled some of the misinformation, the miseducation, did a lot of community harm, right? When you look at all those type of things, it's really difficult to contextualize the role that the media plays now because you are going to these same communities that were harmed by media language, by sourcing, by headlines, by imagery, right? That really fueled a narrative that was being perpetuated by political leaders at the time and by law enforcement, and media fed into that. So you asked something that we do today as a trace. One thing when we think about it too, and I'm going to reference when I was doing my analysis of opioid media coverage and crack cocaine coverage, one of the biggest things that differentiated the two as public health issues is sourcing. Like after a shooting, who do you go to talk to primarily? Is it always law enforcement? Is it always community members who may have an agenda? Is it always political leaders who have an agenda? Is it lack of medical professionals? Is it lack of people in public health spaces? And what I saw when I was doing that analysis and with crack cocaine coverage, there was a clear process and who people spoke to. Oftentimes it was law enforcement compared to something like opioid media coverage, where there was way more health professionals represented in that sourcing aspect, right? For a long time, gun violence reporting followed that same type of process where we saw after and aftermath of shootings, the only people that were being talked to were law enforcement. And that really creates a narrative that was really harmful. And also too, things like parachute reporting, going into communities, getting what you need, and never really revisiting it or providing the proper context. And that in this moment becomes really important as we see like local media die in broad daylight. So that parachute reporting becomes something I think about often. People coming in, leading these communities high and dry after they got what they need to fuel the narrative. The trace is working to undo a lot of those type of things. So like I said, when it comes to sourcing, we make sure that when we're covering these stories, we have a wide array of sources that really represent a public health perspective, like I mentioned earlier, and also too centering the voices of communities. Because a lot of times they haven't been centered, and we also make sure that when we're going into conversations that we're listening to what communities want, what they need, and what really would structure what the true context of stories are. And there's a body of research that's coming out specifically out of Philly, which I think is really interesting about the harm that media reports can do to victims of gun violence and victims of violence as a whole. So also looking to that and listening to what people who have been covered in these situations say, that language or that term, or you got this completely wrong and no one even attempted to follow up, to see that now that there's actual evidence, empirical research that can back this up. I think that the excuses are really becoming null and void because we're hearing firsthand from people who have been victims of crimes or victims of shootings and what they said the media should do and what they should not do. So I think that growing body of research is really helpful. So that's on the journalism front, but then we also brought up the overrepresentation of mass shootings. I just want to circle back to that.
Yeah, please.
It really had a lot to do with who the victim was. Some veteran researchers who have been in the field for decades have telling me there was an approach to let them die, essentially let the worst of the worst kill each other off. And that didn't occur because there's always going to be spillover. And then when that spillover occurred to communities that people didn't think would happen, there was a lot more care and concern. So when I talk to these researchers, it's 2.5 decades of really trying to undo a lot of that process because there was this political narrative. I have a piece that I interviewed a researcher out in Atlanta, and he detailed to me some of that language. And it wasn't until some people that people looked at as valuable became victims that people had more care and concern. So that's why we still see this thing around overrepresentation of mass shootings. Similarly, when we look at things like intimate partner violence, right? If women and marginalized voices, non-binary people of those communities are being overrepresented, there's a complete disregard for those victims. So that's why we have historically seen that. And I think it's important to note that the media has played a role in that, and publications like The Trace are trying to do a lot of that work, and we're hoping that we're doing it well.
There's so much to unpack in what you just said. Being the director of the Office of Gun Violence Prevention for the state of Colorado, a lot of what you just articulated was top of mind for me in that role because that office was housed within the Department of Public Health. And because I am a active student of public health, informed how I wanted to run that office. However, the people who lobbied to get the legislation passed to create the office were the organizations that were mostly white-led, highly funded, and mostly concerned about passing legislation that restricted firearm ownership in hopes of preventing the next mass shooting. I became very frustrated over and over with people not listening to the data, not listening to or not respecting what the data was telling us. You raised an interesting point, the role that media has played in almost sensationalizing the high profile shootings, the mass shootings, and suppressing the other stories that happened around gun violence and the impact on communities and those who are underrepresented in traditional media. The opposite, though, of that is the role that social media now plays in getting the people's voices out there. We have however many cell phones are out there with video cameras where people are capturing the stories happening in real time. Your latest article, as of recording of this episode, talks about the impact of seeing the ICE shootings that happened in Minneapolis, the impact that's having on young people who are on social media and they're seeing these things on repeat. My question for you now becomes, how do you, as a journalist in the trace as a whole, compete with that guerrilla journalism that happens on social media?
I do want to revisit something because I realized in my last response, I skipped over something regarding suicide. You also mentioned suicides, right? So suicides make up the majority of gun deaths. A lot of people do not know that. And throughout the history of gun violence reporting, suicides are a very underreported topic, really due to a lot of different reasons. The difficulty in sometimes families wanting to speak, the nature of the death within it. So a lot of misinformation about what's causing that and who's doing it essentially, and also the means and the mechanism. When we talk about lethality, firearms are the most lethal common form of suicide, essentially. So
Mhm.
when we also study the history, I think it's something that's developing. I just want to also point to, and also it plays a role in demographics in terms of who is most likely to commit suicide. In terms of numbers, we have seen in recent years that rates of young people of color, specifically Black youth, has increased, in Black people as a whole increased in terms of suicide. But historically speaking, white males have been overrepresented in suicide data, essentially in firearm suicide data. So I think that plays a role in the way that's covered. Suicides are underreported topic in terms of gun violence reporting. And it's something that's still developing. And the Trace has a lot of great coverage on suicides and firearm suicide as well.
I'm glad that you spoke on that because, again, one of the challenges that I have in Colorado, while this is not unique to Colorado, Colorado is pretty much a purple state, right? We have Denver, Colorado, we have Boulder, we have Aurora, which is almost even a mix, and then we have very populated areas that tend to be blue, but there's a lot of rural communities in Colorado. And when you look at the data, when you look at the numbers, firearm related suicide is the number one prevalent issue when it comes to what is traditionally called gun violence, to the point where I want to say it's somewhere around 72 or 73% of gun related deaths. What were the assets in the community as far as protective factors, to use public health language? What were the solutions that they were already implementing, and how could the state help? And I went to this one community, so Southwest is in the Four Corners. So we're talking rural, okay? And two separate militias showed up, and a lot of them were armed because the rumor mill had started. They had told themselves that Governor Polis was coming down there with the director of the Office of Gun Violence Prevention to take their guns away. And it ended up turning well because, again, it just turned into a community conversation. I answered their questions and tried to explain to them I had no intention nor desire to take their guns away. I wanted to ask them, how does gun violence show up in your community? And they said, let's stop you right there. We don't have gun violence down here. Gun violence happens there in the city.
Yeah, I'm here.
The gun violence that happens in Denver. And then somebody says, if somebody takes their gun and shoots themselves with it, that's an issue inside their house. It's not a community issue. So, long story short, it's probably too late for that. It got me to a point to where I started to change the language, explaining the work I do. Ultimately, I'm working to do firearm related harm prevention, because when I started having conversations in rural communities and got them to understand that if someone took a firearm and took their own life, their children are harmed. Their spouse, the person who he played poker with or drank beers with on the weekends, their friends feel harmed. And so it goes beyond just that person taking their life. And that got a lot of people open to at least having conversations and thinking about, okay, what role do I play in reducing the risk for my friend feeling like he has to take his own life with a gun? why don't we talk more about suicide, especially as it relates to firearm related suicide in the press? And I know the Trace does a great job, but overall, that's not a topic that most people want to talk about, even though that's like the leading killer of working age white men and even kids.
Really important question, and I think it's really important at this moment, specifically just because due to a lot of the political rhetoric that is going on right now. From my understanding with my reporting is that political narratives and media reporting have a lot to do with what people's conception of what gun violence is, essentially. Looking at trace data, Southern communities and rural communities have higher rates of firearm death and shootings, essentially, than cities in these recent years. And that is something that is still being really misunderstood. And oftentimes it's because, due to the media landscape in some of these places, they don't have reporters who can maybe speak to some of these issues. We mentioned Baltimore earlier, and I speak to people who were at the height of the understanding that mass a public health issue. One of the biggest drivers of understanding that was that they had Johns Hopkins University. Like, they
Right.
had a institution that was there to help really spark this. So in some of these places, in these rural areas, they don't even have access to that, right? And the state resources are so depleted. And when you have a narrative being fueled, people in positions of power don't even take the time to actually rearrange resources to address these issues. So it's a really dangerous cycle. Political conversations and political rhetoric has also fed into this, that gun violence is just exclusively a city problem. I've talked to
Mhm.
researchers who have been in the field for decades, who have done really large studies around suicide, and they actually went to counties across the country that had the highest suicide rates, visiting coroner's offices, visiting community members, and presenting the data to them and being completely fed back that we do not have an issue. So there's this confusion, this denial, and part of that is due to regional misunderstanding of data, but also due to racist narratives. Like, at the height of gun violence beginning to be understood as a public health issue and just gun violence being covered, some of that harmful, if it bleeds, it leads narrative really overshadowed some statistical points because of that context being missing from the conversation of what really
Mhm.
needs to take place. So yeah, I think it's a combination of a lot of factors that plays into misunderstanding of data. Earlier in the conversation, you mentioned about public health right now is a very tense moment and general public turning against the academy for a multitude of reasons. So I think too, it's just mistrust of public health as an entity within itself, political rhetoric, and news reporting that has really fueled this misunderstanding of what gun violence is. Because as we mentioned, suicides make up the largest portion of gun deaths. And also understanding the connection between firearms and the role of suicide. I'm gonna say this a lot. I talk to researchers, all they've told me is, for a long period of time, the connection between suicides, researchers were aware of this. Suicides and firearms wasn't even something that was generally discussed or talked about. Suicide prevention groups were in their silos, firearm prevention groups were in their silos, but there was really not any merging, right? That's something that we've seen within the last 15 years or so. And it's still evolving and it's still developing. But we're seeing that those bridges come together and we can have these type of conversations. There's a lot of confusing parts that can make this a huge issue. So I'm happy that you asked about that because I think it's really important to understand all of these puzzle pieces that go together.
Yeah. Thank you for such a thorough answer because you just explained that it's such a complex topic or a complex issue, and there is no easy, simple solution. And that a lot of different things, people, agencies, community based organizations, researchers need to come together in order to craft solutions. Again, I'm just speaking to a lot of my frustrations. We get so siloed in the work. You spoke to the silos between suicide prevention and firearm related research, and now that it's starting to come together, we have researchers who are actively approaching the intersection between firearm ownership and suicide. I want to shift topics. For your latest article, as of this recording, speaks to the impact that repeated social media viewings of the shootings in Minnesota are the impact that's having on young people who are probably the most digitally literate generation we've ever had, who are exposed to so much information at a rate that is unprecedented. You spoke to just the harm. I don't want to say impact, but actually the harm that is occurring because these young people are seeing these murders happen in real time repeatedly. Talk more about that article. It's really piqued my interest.
Thank you. So I covered a recent piece that dealt with really the aftermath of the two shootings in Minneapolis by immigration enforcement officials, right? So the shooting of Renee Good and Alex Preddy. And what we saw is that these videos have been circulating online millions of times, essentially, right? And there is emerging data to see how many times, like, the video of Renee Good being shot was seen by American adults, but there isn't a lot of information on the viewership of young people, essentially, who make up a large portion of social media users. And what we know from past research is that viewing these videos is very, very harmful for young people. In the 2019
Mhm.
study by researchers at USC, they actually assessed the way that police shooting affected young people, essentially, and it caused depressive episodes, depression, particularly among young people of color, Black individuals specifically. So I think that there's important to also talk about identity in this space, because when you look at the history of bystander shootings, it really starts around 2009 with Oscar Grant. Violence has been captured on film and media for decades, essentially, but Oscar Grant really kind of shifted a moment in terms of what was taking place, right? And Oscar Grant was a 22-year-old Black man in California who was shot by a BART officer. And what really fueled people in that moment with that video being spread is that the shooter looked very unprovoked, right? And throughout that period, that has only really accelerated. Like, there's continuous issues. We think about Ahmaud Arbery, we think about the Buffalo Market shooting, which was live streamed by the perpetrator. And also, this is happening at the time where police body cam footage is emerging and is accessible in aftermath of these events. That really starts around, I believe, like 2020. It was being adopted by cities prior to that and by local outlaw prior to that. Well, this is all happening at a moment, and what research says is that it has a negative effect on young people specifically. And what is really unique about this moment when I was talking to researchers is that there is a effort by political leadership to really not engage with what's being taken place in the video, deliberate effort to promote propaganda in light of what's actually being shown in the video. So people are starting to feel gaslit. And when I talk to experts, they say that's particularly dangerous for young people to be able to watch something, and for people in positions of power to blatantly ignore what's being taking place, and for these people to be, demonized or use language that doesn't accurately capture what is happening. But what I was noticing when I was doing this research is that when we talk about, like, the police videos, like the study with USC, is that that's something that has been difficult for Black people specifically. Like, when I mentioned some of the shooting videos, like we talk about Oscar Grant or Ahmaud Arbery, these are videos of young Black men, and they have
Eric Gardner, man
bloodline.
down in Baton Rouge, Philando Castile, right? Like, go ahead.
Yeah,
Just, yeah.
no, thank you for including those other names, because there's so many examples of watching Black men be essentially murdered on repeat, right? And when I talk to the researchers, what they explain is there's this misconception that people get desensitized. There's actually research that contradicts that. The viewership of that only heightens your anxiety, only heightens your depressive state, only heightens your PTSD. And what they say is that people are actually anticipating the next shooting or the next event. They're trying to wrap their mind around it. And I do want to also say they do give a guideline to how you can engage with this footage, understand to be informed, but not to be consumed by it. And also, community is very important, right? Like, watching these videos and talking about it with someone instead of continuously watching it and just having it something that you dealing with internally. Like, make sure that you have spaces to engage with it. And also how this affects your physical health. What they see is that your muscles tense up when you watch this. You have breathing issues. Like, this is a common factor that plays in these videos. And going back to the thing about constantly seeing Black men be shot on camera or just be murdered on camera with the widespread circulation of this, another aspect that is harmful is what I understand it too is like the lack of accountability, right? Like, when I was
Mhm.
mentioning with the recent shootings, like, that language can be really big harmful. And what researchers say, like, in the aftermath of watching someone wrongfully be shot down and there isn't any repercussions, it can really heighten anxiety. And it's something that's constantly evolving, and unfortunately, there's an uptick to it. So there's a huge connection between access to these videos constantly on repeat and things like mental health issues. They've had depressive disorders or PTSD. So, and that can be incredibly sensitive for young people.
In 2020, I was essentially ringing the alarm about the same thing because, first off, everybody was already anxious and stressed because of COVID, the political climate, the stay-at-home orders, all of that was happening. And at the same time, we had these repeated incidents of Black men being killed. And it was just, I mean, it was what they would call a perfect storm of you're locked inside your house. You have access to this footage of somebody who looks like you, who you can identify with, and I would say as a Black man, but even with Breonna Taylor. So there was this thing with Black women as well, Black people in general. And it was just the doom scrolling, and it was showing up consistently in the feed. As you said, the trauma response, even if it's not overt, the trauma response is there because you talked about the physiological responses of tension in your body, shallow breathing, sometimes sweating or feeling clammy, all of these symptoms of a trauma response. There is research on a condition that is called continuous traumatic stress disorder. What post-traumatic stress disorder presumes that the traumatic event has happened and then it passes, and you can still be triggered into a trauma response when something activates that trauma response. But continuous traumatic stress disorder recognizes that, particularly in people, Black men, there's a constant underlying level of a trauma response happening. And this isn't just stress. This is when the stress rises beyond the body's capacity to respond appropriately. That comes from inherited or generational trauma, complex trauma, so multiple traumas happening, chronic trauma, so the trauma is happening all the time or repeatedly, and then an acute trauma can happen that will then send somebody over the top like a volcano, and they're responding in ways they're just constantly agitated, activated, and then we send them to school, especially our young men who still don't even have the emotional intelligence to understand how to regulate all of this. They're watching this video before on the way to school, whatever. They get to school, and the teacher asks them or embarrasses them by asking them to read or to do something that, whatever it is. And then this young man snaps, and we're like, oh, he's just bad, right? He's one of them. It's like, no, his trauma has been activated. I so apologize, went down that rabbit hole. I'm so glad that there is journalism now that is calling attention to another side of the story.
And I want to point out something. I'm
Yeah,
excited that
go
you
ahead.
mentioned the responses, like when people go to school or something like that and behavioral issues arise. I've covered research that actually looked at gun carrying, specifically amongst
Mm,
male folks in general. And a lot of the times, young men who carry firearms or young people who bring firearms to school or in spaces that they necessarily shouldn't have them is out of fear. There's a constant pressing fear that they're dealing with, so they're carrying these firearms out of protection. And I'm happy that she brought up the COVID-19 angle specifically because when I was talking to researchers, that particular period of time was really debilitating, right? Because there was this back-to-back things that you mentioned with the kinds of shootings, people passing away from health issues, just the financial issues. We also know that the rise in gun violence surges during this time period, specifically among children and teens. So there was a lot that was happening in this moment. And I just wanted to say, when you mentioned the thing about sometimes people are just dismissed as being bad or why there's not understanding for firearm carrying, specifically among youth, research clearly says that these people are experiencing heightened anxiety, heightened worry, and have been found to be victimized of some sort of violence themselves. So they're looking to protect themselves.
let's stay right there because while I don't remember specifically if you did coverage about this in any of your articles, and I read a lot of them. Part of the conversation, again, and this is revisiting something we talked about previously, but I think this is still appropriate. The conversation about mass school shootings. I recognize how tragic it is when children are killed in these mass shooting incidents at a school. I also want to acknowledge that those incidents are not a daily occurrence, whereas there are young people, school age kids, school age people who are actually killed either in their communities, on their way to school, or even in their own bedrooms, because suicide by unattended or easy access to a firearm within the house is a huge contributor to youth firearm related suicides. And again, this may be retreading something we talked about, but at least we're talking about it, because very rarely do people want to acknowledge those deaths that happen outside of the schools, those deaths that happen inside the bedrooms. I know the Trace has talked about some of this. I would just love to hear your thoughts and your perspective of what you've learned in your reporting.
Yeah, really important question that we have some time to really parse this out and revisit it. Mass shootings make up a small percentage of shootings nationally, and they're overrepresented in media coverage. We talked about sensationalism and how that perpetuates fear. That plays a huge role in why that overrepresentation really occurs. And the concept of when you're able to identify with victims, researchers say identification plays a huge role in why we care about the things that we do, why the things that are covered, and why things that get attention or why money and resources are poured into certain areas while other things are not. I'm happy that you said that you don't want to ever come off as being not sensitive or not kind to this issue, because it can come off that way from the language. But trying to understand it and navigate it in the sense of identity is really important, because it lets us understand potentially why these events are over covered in the way that they are compared to the reality of what data shows us about shooting. Identity plays a huge role in terms of essentially why things that are covered are the way that they are, and things that are
Mm.
under are essentially why that's taking place.
With all the work that's happened over the last, I'm going to say, like, generally the last 6 years, almost even 7 years, because CVI, community violence intervention, has been around for a long time. In 2019, 2020, we started to see it get more attention and more support. The investments really started to show up in a major way, partially because of advocacy from some really strong champions for the field. But then also, as you mentioned, the surge of gun violence incidents that were happening in 2020, communities were looking to do things differently. Here we are, we're at the end of 2025. So many different cities were reporting record numbers of decreases in gun violence, community violence, domestic violence across the board, even violent assaults. And looking at it through a public health lens again, we know this is the lag measure. These things are a result of work that probably started in 2020 and 2021. The investments that were made through the Bipartisan Safer Communities Act funding, ARPA funding, and other major investments into the field of community violence intervention. However, if you read most coverage of these record drops, you read the press releases, you look at the press conferences, law enforcement's being thanked, politicians are being thanked, mayors and other people are taking credit, and you we're not necessarily seeing the community violence intervention people who have been doing this work getting any of the credit or very little credit. I guess I want to hear what's your reflection, your opinion about that dynamic? Am I reading that wrong?
I think you're absolutely reading it correct, because it's something I've heard from people who are on the ground. This is like a really conflicting moment for them, where they're really happy to see this historic lows, but they're really concerned with the crediting of why we are seeing these drops, because that connection between investment in these resources, like you mentioned CBI, like things like hospital-based violence intervention programs, like that being shattered by some of the things like law enforcement, are really concerning to the people who are on the ground, because if people are not able to make those connections of how we got here, there's fear that we can go back to essentially a place where these things have been underinvested. And essentially that's happening. And another concern that they have, I'll just also put this in here, is that political rhetoric is not matching with the historic drop in lows that we're seeing in crime. There is, unfortunately, a lot of fear that violence is at an all-time high, despite what data is
Mm-hmm.
showing. So there's a huge conflicting point with a lot of the progress that's being made because it's not being connected to a lot of the public health advancements that you just discussed in terms of this unprecedented investment into CBI and things like HBIPs. I'm happy that you mentioned that it's a lag because we're seeing as funding dwindles, a lot of CBI programs are trying to situate what their funding looks like in the future. And so also with research, a lot of researchers are trying to see what funding looks like, really relying on state and philosophic efforts. It's a really conflicting point in it's a narrative that's old, is essentially what I will say. Like,
Mm-hmm.
when crime is doing well, when crime is doing bad, law enforcement, like, it's a
Mm-hmm.
narrative that has been perpetrated for a while, but researchers are doing their best to sound the alarm. But I also wanna connect to something that's even beyond gun violence, and I might have talked about it earlier. The public distrust in science and scientific institutions and public health is also having residual effects of things of this nature when we talk about who is thanked because if we're still fighting to get nonviolence understood as a public health issue and people are just trusting public health as a whole when it comes to things like vaccines and so many things of the other nature, it's just really difficult for public health to be recognized in this space. When I talk to people who are in the field, they say public health is often viewed as an invisible shield or it's really a thankless job. You're not able to kind of see why the things that are working around you are working the way that are. So I think it's a combination of things. Like I said, I think it's an old narrative, and I also think it's a really tense moment in being able to recognize the way that scientific innovations and investment in public health can really be helpful. And then too, I just want to also share that a lot of people still are not sure what CVI is or what community violence intervention
Mm-hmm.
work even is. When you're in these spaces, you have these terms and they come up often, but on a larger front, if we were really were to ask most of the general public, are they familiar with CVI work or do they know what a CVI worker is? And a lot of that goes to mention history as well. People saying that they're not sure if CVI is really effective, despite the research that shows it's a model that works really well. I think too, just people lack understanding around CVI and what CVI workers do and who they are, where they show up, plays a role in that lack of credit to go to some of those investments that you mentioned earlier that really play a role in the decline.
I want to stay here because you even talked about the conflicting narratives. We have evidence that violent crime is down, right? Like by almost every measure that you could look at, law enforcement is saying it, public health is saying it, even the traditional media is reporting this. And then you have, without naming names, the loudest voice in the country, if not the world, saying that DC, Minneapolis, California, and these other cities are being overrun by violent crime, and then sending in federal troops to suppress and have this law enforcement military like presence in these cities, and then say, oh, see, it worked. We brought in the National Guard and now violent crime is down. I guess my question then becomes, how do you see not only media, but the general populace fight back against this gaslighting that is obviously and blatantly happening?
Yeah, it's really interesting times that we're in. I'm happy that you mentioned that it's not a singular solution to these things that we're seeing with like the historic drop in crime. It's a combination of efforts and leveraging my reporting and my interviews with people who are on the ground or researchers. It's really a part of a larger agenda to really accomplish goals that maybe certain political leaders have, essentially, is my understanding, to really ignore some of the things around data, to really achieve some of their own personal agendas in terms of having a police state or a presence. Like when we look at things around ICE and ICE shootings recently, a lot of people are even questioning why they are in Minneapolis. And when I talk to people who are in the field, when I talk to people on the ground, they clearly understand it as a political agenda rather than really putting forth the resources to things that you mentioned earlier that have really played into why we see these drops.
To have a conversation with somebody who is looking at the issue through a critical eye of a professional journalist, it's such a pleasure because I get this opportunity often to engage with somebody like this. So who isn't actively working in the field as a CVI worker or a researcher, and you're absolutely part of the ecosystem. And I think that's where my next to last question for you is. when we talk about the complexity of the issue, when we talk about complexity of the tactics and the strategies that are necessary to address a complex issue, I am a advocate of it's an all hands on deck type deal. Again, using a public health approach is recognizing that a person's environment and the ecosystem that in which they are placed is going to contribute to the health outcomes of that person in that population. So the question then becomes, where do you see not just the trace, but the type of reporting and journalism that the trace does? You and others who are willing to approach this with a critical thinking eye, where do you see yourselves in the ecosystem of firearm related harm prevention and gun violence prevention?
Yeah, I really think it's important to really understand us as meeting the moment. Revisiting the piece that I did around bystander video, one thing that came up constantly in these conversations is because of the gaslighting that may be taking place with political leadership and political rhetoric around what was taking place, contradicting to what was being seen in the video, is the importance of context by reporters and journalists to really capture what's actually happening on the ground. So when I say meeting the moment, it's really properly contextualizing what's taking place because there is so much white noise, so much confusion about what's happening in the moment. So really placing the proper context first so people are able to really navigate the space with being well informed. I think too, even beyond that, like when we had a conversation around advocating for science and public health, a lot of that can be done through media reporting, essentially, right? Bridging the gap between the academy and the general public. So really leveraging data. We mentioned earlier the 4 steps to a public health approach. Essentially, a lot of that is really data centric and data focused. So I think that it's also really important to understand that through that angle and really making sure that we're putting the right voices forward and also centering and listening to communities as reporters, keeping our ear to the ground and making sure that we're talking to people that we need to talk to and making sure that they kind of have the voices that they need to have in terms of amplifying their correct voices and that their voices feel like they're part of the conversation. So yeah, that would be essentially what I would think is the role that we play in some of these big things that are really shifting. Yeah, really important question. I think of in this current space as this really meeting the moment. And when I say that, I'm gonna like reference the piece that I did earlier about bystander camera footage, essentially, and bystander cell phone videos that have played a huge role in our understanding of gun violence and witnessing gun violence. And what was coming up often is that when there is so much political propaganda or political rhetoric that really feels like gaslighting to the general public, that people will look for answers within journalists, right? They're looking for context. So when I say meeting the moment, it's really contextualizing what is taking place so people are able to navigate it properly with the proper information. Just as a public health reporter, there's a lot of attacks that we're seeing science go through at this moment. So really amplifying the correct voices, whether that's leveraging data and also whether there's an understanding of what's happening from an accurate and factual place. And then listening to communities, centering their voice. As a reporter, it's important to keep your ear to what people are saying that they want and what they need from a community level of the people who are most likely to be victims of various forms of firearm violence. So making sure that all of that's happening in conjunction seems that is the best approach to really understanding what meeting the moment means because there is so much that is happening.
That is awesome. I want to ask you one last question here. When you choose a story or story is assigned to you, what is your objective? What is it that you want the audience, your reader, to walk away from? What is your objective for every story that you do?
The first thing that comes to my mind is like really to just inform the public with the right information. So just making sure that I am sharing the right information and amplifying the correct voices and also properly contextualizing events because this is a record, right? People are going to revisit what took place. And you have to make sure that you're able to make sure that revisiting takes place in a proper manner. We're adding to that catalog and that record that people are going to revisit. And I really approach every story with the best ability that I can to properly contextualize what's going on, sourcing that is diverse, and it also is proper to what the story needs to be to humanize people who may have not be humanized essentially, or there might be like a lot of complication. One was understanding who those individuals are and really inform. Like that 4-step approach is so important. Because it's like when I go out in the world and I tell people I'm a public health reporter that covers gun violence and people's face is puzzled, it lets me know that there's still so much work that needs to be done for people to really understand gun violence as a public health issue. So because of that is my beat, my work is really tailored on making sure that I'm doing that to the best of my ability from my sources, from the people that I'm talking to, from the people that are mostly affected by this issue, and see what the future can hold essentially in terms of where my reporting can fit in that future of people understanding the issue and making some headway to reduce it.
All right, y'all. Look, as I promised, I brought y'all yet another dope guest onto the show. If you made it to this point of the episode, you obviously agree with me. So you can thank me now by following the podcast if you're not already following on YouTube, Spotify, Apple. Rate us. I think it's like a 5-star rating system on Apple. And most importantly, if you have any follow-up questions for me, for our guest, for Fairriona, feel free to ask those questions or just expand the conversation in the comment section on YouTube or social media. All of the different ways that we're out there, however you're consuming this content, it helps us elevate the conversation and help people understand the work that's happening out there. With all that said, I really do appreciate y'all, and we'll be back next time with another episode of The Incredible Messenger. Peace.